Let me ask you something. More than 40% of Americans over the age of 60 are currently taking a statin drug to control their cholesterol. 40%. That's tens of millions of people. And there's a very good chance that either you're one of them or your doctor has had that conversation with you. And I get it. Heart disease is still the #1 killer of Americans over 60. Of course your doctor is concerned. Of course they want to do something about your cholesterol numbers. But here's what bothers me after years of working with older patients. We hand people a statin. They deal with the muscle aches, the fatigue, sometimes the brain fog, and then 5 or 10 years later, they're still having cardiovascular events. Why? Because a statin does one specific thing. It lowers LDL cholesterol production in your liver. That's it. And for people over 60, that's only part of the problem. What if I told you there are 5 foods, real foods, things you can buy at any grocery store that have been shown in clinical research to work on the same biological pathways as statin drugs? Some of them address things statins don't even touch. I'm not here to tell you to throw away your medication. Please don't do that without talking to your doctor. What I am here to tell you is what the science actually shows, and to give you tools that work with your body after 60, not against it. Stay with me, because food number 3 on this list is going to surprise you. It's something most seniors already eat, but almost nobody knows it activates the same cellular pathway that certain cholesterol-lowering drugs are designed to target. We'll get to that. First, let me take 2 minutes to explain what statins actually do, and more importantly, what they don't do after 60. Because that context is going to change how you see every food on this list. Here's the basic mechanism. Your liver produces cholesterol. It needs to, because cholesterol is essential for hormone production, cell membrane health, and vitamin D synthesis. Statins work by blocking an enzyme in the liver called HMGCoA reductase. Block that enzyme, your liver makes less cholesterol. LDL levels in your blood go down. That's the whole mechanism. Clean, simple, and genuinely effective at reducing LDL numbers on a blood test. But here's what statins don't do. After the age of 60, the reason your arteries become dangerous isn't just LDL cholesterol. It's 3 things working together: chronic low-grade inflammation inside your artery walls, oxidative stress that turns LDL particles into a form that's far more damaging, what we call oxidized LDL, and endothelial dysfunction, which is the gradual breakdown of the thin lining that keeps your arteries flexible and healthy. Statins don't target inflammation directly, they don't neutralize oxidized LDL, and they don't repair endothelial function. There's one more thing I want you to know. Statins deplete your body of something called CoQ10, coenzyme Q10, which your muscle cells need to produce energy. This is why muscle pain and fatigue are so much more common in older adults on statins than in younger patients. Your CoQ10 levels naturally decline with age anyway, so statins can push that depletion further. Now, the 5 foods I'm about to show you don't just lower LDL, they address inflammation. They reduce oxidized LDL. They support arterial flexibility. That's a more complete picture of cardiovascular protection after 60. Let's get into them. Food number 1, oats. I know, you've heard eat your oatmeal your whole life, but I want to explain why it belongs on this list in a way most people have never heard. Because when you understand the mechanism, you'll never skip breakfast again. The active compound in oats is called beta-glucan. It's a type of soluble fiber, and what it does in your digestive system is genuinely remarkable. When you eat oats, the beta-glucan forms a thick, gel-like substance in your small intestine. That gel binds to bile acids, the compounds your digestive system uses to break down fats. Normally, those bile acids get recycled back into your bloodstream, but when beta-glucan traps them, your body has to excrete them instead. Here's the key. Your liver needs bile acids, so when it runs short, it pulls cholesterol from your bloodstream to manufacture more. Your LDL levels drop directly, measurably, and consistently. The FDA actually recognized this back in 1997, granting oats an official heart health claim, one of very few foods to ever receive that distinction. Now here's the age-specific piece. After 60, gut motility slows down. Food moves through your digestive system more slowly, and your bile acid recycling system becomes less efficient. That actually makes beta-glucan more impactful for older adults, not less. You're working with a system that already needs the help. Practical guidance. You want at least half a cup of rolled oats per day to hit the therapeutic dose of beta-glucan, roughly 3 grams. Steel-cut oats are your best choice because they're less processed and release beta-glucan more gradually. Instant oats still help, but they're lower on the effectiveness spectrum. And I'll tell you right now, when you combine oats with food number 3 on this list, you get a synergistic effect that neither produces alone. Keep that in mind. Food number 2, fatty fish. Omega-3 fatty acids from fish have decades of cardiovascular research behind them, and I want to be very specific about what they do, because good for your heart doesn't tell you anything. There are 2 omega-3s that matter for cholesterol and arterial health, EPA and DHA. Here's what they actually do. First, they directly reduce triglycerides, the other fat in your blood panel, by slowing down the liver's production of VLDL particles, which eventually become LDL. Second, and this is where it becomes especially relevant after 60, EPA and DHA suppress inflammatory cytokines. These are the signaling molecules that drive chronic arterial inflammation, the same inflammation that makes cholesterol plaques unstable and dangerous. Here's what statins don't address: oxidized LDL. When LDL particles get oxidized by free radicals in your bloodstream, which happens more frequently in older adults because our antioxidant defenses decline, they become far more likely to lodge in artery walls and trigger plaque formation. Omega-3s from fish help neutralize that oxidative environment. And for those of you over 60, I want to mention something beyond cardiovascular health. Omega-3s are simultaneously one of the best studied nutrients for brain health, joint inflammation, and reducing dry eye, all things that matter more as we age. When a food works this hard on this many systems, it earns a permanent spot in your diet. Practical guidance. Aim for 2 to 3 servings per week. The most potent sources are wild-caught salmon, sardines, and mackerel. Sardines in particular are exceptional because they're small fish with very low mercury exposure. If you're going to supplement with fish oil, please pay attention to the quality. Fish oil oxidizes easily, and rancid fish oil can actually increase oxidative stress. Look for products with a third-party purity certification and always store them in the refrigerator. Food number 3, berries. All right, this is the one I promised you at the beginning. Most people think of berries as a pleasant, healthy food, good antioxidants, nice color, pairs well with yogurt. They don't think of them as having drug-like activity in the body. But the research tells a very different story. Blueberries, and to a similar extent blackberries and strawberries, contain compounds called anthocyanins and a lesser-known molecule called pterostilbene. And here is what makes this remarkable. These compounds activate a cellular energy sensor called AMPK, AMP activated protein kinase. Now, you may have heard of AMPK in the context of diabetes medications like metformin. Here's why that matters. AMPK activation does several things simultaneously. It tells your cells to burn fat for fuel. It increases the clearing of LDL from your bloodstream. And it reduces the production of inflammatory molecules in your artery walls. Think of AMPK as your body's internal fuel efficiency gauge. When it's activated, your metabolism shifts into a smarter mode, burning fat, clearing cholesterol, calming inflammation. Blueberries essentially nudge that gauge in the right direction. But there's more. After 60, one of the most dangerous cardiovascular changes isn't cholesterol numbers, it's arterial stiffness. Stiff arteries put enormous strain on your heart and dramatically increase the risk of a heart attack or stroke. The anthocyanins in berries have been shown in clinical studies to directly improve endothelial function, the health and flexibility of your artery walls. That's a gap statins simply don't fill. Practical guidance. Half a cup to 1 full cup of berries daily is what the research supports. And here's good news for anyone watching their grocery budget. Frozen blueberries are just as potent as fresh. The freezing process does not degrade anthocyanins. In fact, some studies suggest mild freezing can actually improve their availability. And remember what I said after food number 1? When you combine oats and berries in the same meal, your morning bowl, the beta-glucan reduces LDL through the bile acid pathway, while the anthocyanins activate AMPK and protect your artery walls simultaneously. Two completely different mechanisms working together. That's a powerful breakfast. Food number 4, garlic. Garlic has been used medicinally for thousands of years, and for a long time it was dismissed by Western medicine as folk remedy territory. The research has since caught up, and what it shows is that garlic's active compound does something genuinely statin-like at the biochemical level. When you crush or chop raw garlic, you trigger the formation of allicin, and allicin has been shown in multiple studies to inhibit the same HMG-CoA reductase enzyme that statins target. It's not as potent as a pharmaceutical dose, but the mechanism is real and measurable. But here's where garlic becomes especially valuable for people over 60. The benefits extend well beyond cholesterol. Allicin reduces platelet aggregation, meaning it makes your blood less likely to form dangerous clots. And multiple meta-analyses have confirmed that regular garlic consumption produces meaningful reductions in systolic blood pressure. After 60, blood pressure tends to rise because your arteries become stiffer and less elastic. The combination of cholesterol-lowering activity, anti-clotting effects, and blood pressure reduction makes garlic a remarkable cardiovascular food, one that addresses several aging-related risk factors at once. Practical guidance. 1 to 2 fresh garlic cloves per day is the dose most studies use. Here's an important preparation tip that most people don't know. When you crush or chop garlic, wait 10 minutes before cooking it. That resting period allows the allicin to fully form. If you throw garlic straight into a hot pan, the enzyme that creates allicin gets deactivated by heat before it can do its work. If you genuinely can't tolerate the taste or the odor, aged garlic extract, the kind sold in supplement form, has good research behind it and is odorless without losing its cardiovascular benefits. One caution I want to mention: if you're on warfarin, aspirin therapy, or any blood thinner, talk to your doctor before significantly increasing your garlic intake. The anti-clotting effect is a benefit for most people, but if you're already on medication that thins the blood, you want to make sure there's no additive effect that hasn't been accounted for. Your doctor needs to know. Food number 5, avocado. Avocados have had a good decade in the nutrition world, and they deserve the attention. But the reason most people cite they have healthy fats doesn't actually capture what makes them so specifically powerful for cholesterol management after 60. The compound I want you to focus on is called beta-sitosterol. Beta-sitosterol is a plant sterol. Structurally, it's very similar to cholesterol. And because of that structural similarity, it competes directly with cholesterol at the absorption sites in your small intestine. Think of it like two cars trying to pull into the same parking space. Beta-sitosterol gets there first, takes the spot, and dietary cholesterol gets passed right through. The result is a direct, measurable reduction in LDL through a mechanism completely different from statins and completely different from oats. Different pathways, same beneficial result. The monounsaturated fat in avocado, primarily oleic acid, the same fat found in olive oil, also raises HDL cholesterol. But here's something most people over 60 don't hear enough. After the age of 60, it's not just your HDL number that matters, it's HDL quality. High-density lipoprotein can become dysfunctional as we age. It's present in the blood, but it loses its ability to carry LDL away from artery walls effectively. The oleic acid in avocado has been associated with improved HDL particle function, not just quantity. And one more benefit worth mentioning. A single avocado contains more potassium than a banana. Potassium directly supports blood pressure regulation by helping your kidneys excrete sodium more efficiently. Again, multiple cardiovascular benefits working simultaneously. Practical guidance. Half an avocado per day is a realistic, practical target that aligns with what clinical studies have used. The key point is substitution, not addition. Replace butter on your toast. Replace cheese as a side. Replace mayonnaise in a sandwich. If you simply add avocado on top of an already high-calorie diet, you'll offset the benefit. Swap it in for saturated fats. That's where the effect is most pronounced. We're about halfway through, and if you're finding this useful, I'd really appreciate a like on this video. It genuinely helps YouTube show this information to more seniors who need to hear it. Hit that button if this has been worth your time. And stay with me for the last few minutes, because I'm going to take these 5 foods and show you how to fit them into a simple daily pattern. No complicated meal plans, no expensive routines, just a realistic protocol that takes less than 10 minutes of active effort each day. That's coming right now. Knowing what 5 foods to eat is useful. Knowing how to actually fit them into your life without overhauling everything, that's what I want to give you right now. Here's what I call the 60-plus cholesterol protocol. It's built around 3 simple anchor points in your day. Morning, 5 minutes, 2 foods at once. Half a cup of steel-cut or rolled oats with 1 cup of mixed berries. That's foods number 1 and number 3 combined in a single bowl. Beta-glucan lowering your LDL through the bile acid pathway. Anthocyanins activating AMPK and protecting your artery walls. All before 8 a.m. You can add a small handful of walnuts if you like. That adds a plant-based source of omega-3s on the days you don't have fish. But the core is oats and berries. Keep it simple. Lunch or dinner 3 days per week. Incorporate fatty fish as your protein source 3 times per week. Salmon, sardines, mackerel, any of the 3. A standard serving is about 4 to 5 ounces. On those same days, add half an avocado as a side. That's foods number 2 and number 5 together. Omega-3s reducing inflammation and triglycerides, beta-sitosterol blocking cholesterol absorption, oleic acid supporting HDL quality. On the other 4 days, continue eating whatever protein you prefer. The fish doesn't need to be every night. Consistency over weeks and months is what moves your lipid panel, not perfection every single day. Daily, 0 extra effort. 1 to 2 cloves of garlic incorporated into any cooked meal. Crush it, let it sit for 10 minutes, then add it to whatever you're already making. Pasta, stir-fry, roasted vegetables, soup. Garlic goes with almost everything. This is food number 4, and it costs you nothing in terms of time. You're just adjusting how you prepare food you're already cooking. Now, I want to be honest with you about timeline. You're not going to see your lipid panel transform in a week. The research on these foods consistently shows meaningful changes, LDL reductions in the range of 10 to 15% for some foods individually, more when combined, after 8 to 12 weeks of consistent intake. That's a longer runway than a drug, but there are no side effects, no copay, and the benefits extend to your joints, your brain, your blood pressure, and your energy levels simultaneously. And here's something I've seen again and again with older patients. When people make these 5 foods a consistent part of their diet, the conversation with their doctor about medication often changes. Some are able to reduce their dose. Some transition off entirely under medical supervision. I'm not promising you that outcome. Everyone's biology is different. But the potential is real, and it's worth having that conversation with your physician. Let me bring it back to where we started. Statins are a useful tool for the right patient at the right dose for the right reason. I'm not dismissing them. But after 60, the cardiovascular picture is more complex than a single LDL number. Your arteries are dealing with inflammation, oxidative stress, endothelial aging, and HDL dysfunction, none of which a statin alone addresses. The 5 foods we covered today, oats, fatty fish, berries, garlic, and avocado, work on those mechanisms. Some of them directly share pathways with pharmaceutical drugs. All of them have peer-reviewed clinical evidence behind them, and all 5 of them can be at your grocery store by this afternoon. As always, please do not stop or change any medication without speaking to your doctor first. What you can do, starting today, is add these foods to your routine and bring the research to your next appointment. Your doctor should know you're doing this. Before I go, I want to ask you something in the comments. Are you currently on a statin? Have you already been eating any of these 5 foods? Let me know your experience. I read every comment, and your stories help me understand what topics matter most to this community. And if you want to go deeper on cardiovascular health after 60, I've got a video coming up on natural ways to address blood pressure, another area where food can be extraordinarily powerful, and where the research for older adults is often very different from the standard recommendations. I'll have that link on screen right now. I'm Dr. Leonid Kim. Take care of your heart. I'll see you in the next one.